In this video, we'll discuss about biopsy. So, coming on to the definition of biopsy, biopsy is the removal of the tissue from the living organism for the purpose of microscopic examination and diagnosis. Now, in some cases, it does not always only doesn't always only help in doesn't always only help in diagnosis, but also serves as a treatment option for the smaller lesions by excising in total. Okay, now let's talk about the indications. To remember the indications of biopsy, I want you to remember a girl named as Binu with two eyes and her character. All right, so I just want you to remember this. Now by B, what we have is the bony or intraosseous lesions that are not specifically identified by radiological findings. Example, Paget's disease. Now by another eye, I want you to remember the impression of lesion. Then we can talk about another eye. If for this eye, you can remember that the lesions that interfere with oral function. Then by N, you can remember the nature of abnormal tissue that is removed. Then by U, you can remember unknown. So it is basically lesion is not responding and inflammatory changes. Of unknown origin. Then by character of malignancy. Now biopsy is of a lot of types. We will enlist them. First is the incisional, excisional, punch cut, exfoliative, cytology, then FNAC, then frozen section, brush biopsy, core biopsy. Alright, even exfoliative biopsy. Now we will talk about the two main types which you need to know for the exam as well and for vivas. One is the incisional and one is the excisional. Okay, now suppose this is our tongue, all right, and we have something of a tumor or some pathology, and we are taking the biopsy. Similar condition over here. Okay, yes. Now what you will see is, in particular this case of incisional biopsy, the incision will be something like this. That is, it will also include the normal tissue and some part of the lesion. Alright, but in case of excisional, what you will see is that there is this incision that is going to include all the lesion as well as some part 2 to 3 mm mainly of the of the pathology as well, that is of the lesional tissue as well. Now incisional is basically when there is done basically it is done when there is a malignant lesion, or if there is a lesion which is having multiple biopsies are needed for basically because it has different characters at different location, the lesion different characters at different location. Then it is also this incisional biopsy is also preferred in bigger lesions. Okay, so it is also preferred in bigger lesions. Now, whereas on this side of excisional, it is done in cases of benign, and it is done on smaller lesions. All right. Now, there is a contraindication as well for the incisional biopsy. Also, this is basically done for central body lesions, and this is done through the periphery of the all the lesion. Okay. Now, in contraindication, it is not done in pulsatile lesions. All right, vascular pulsatile lesions. Also, it is not preferred um, in the pigmented lesions. All right. So this is basically the two types that are usually asked in Viva. Now let's talk about the method of biopsy. In method of biopsy, it can be done in a number of ways. Either the surgeon can be using a surgical scalpel, or they can be using they can use a uh, high frequency Cautery forceps. Now, the problem with this is it causes the dehydration of tissue, whereas this does not cause the dehydration of the tissue. Then they can also do with the bone needle. Then exfoliative cytology technique is also there. The preferred instrument is scalpel usually. Also, I'll discuss about it again. Then these are all. Then you can also be using a cutting knife, a laser. All right. Now, in the biopsy technique, now this is basically a simple procedure which is carried out by the dentist if proper precautions and proper technique is followed. All right. Now, there are certain things or the precautions or the points that need to be remembered while taking a biopsy. So, the first one being that do not paint the surface of lesion with iodine or any colored antiseptic. Then, if you're using infiltration anesthesia, it should not be completely thrown or injected on the entire lesion, but it should on the body of the lesion. It should be infiltrated onto the periphery of the lesion. Always use a sharp scalpel to avoid tearing off tissue. Also, there is 10% formalin fixative is used. There is one thing that if the excised or the biopsy sample, it is thin and small, then a glaze paper should be used to avoid the curling of tissue. Also, it is very preferable to remove some of the soft tissue, some of the normal tissue along with lesional area. Because then we will be able to compare them both in the slide. All right. Then there is biopsy report. Now, if it is positive, then the treatment is started, and if it is negative, it is not taken as a definitive thing, because if the diagnosis is already pointing towards a certain pathology, then it is repeated. There's a number of times it is repeated, and then only you can say that it is a negative report. Now, to remember the contraindications of biopsy, you can remember it as BAPSIL. Okay. Now, by B, we have bleeding, when there is bleeding, then when the patient is on anticoagulant therapy, then when the patient is uncooperative, then when there are sepsis chances are very high, then when there can be an infection, also when there is lung function impairment, it is contraindicated. I hope you understood the main working going behind biopsy. So I hope you liked the video. Thanks for watching. Do subscribe to my channel. Yeah.